Most popular one is biomechanics matters.
Biomechanics doesn't matter at all.
Biomechanics does matter in a general population.
Biomechanics are needed or not determined by the application of load. Low load and high load.
High load activities, biomechanics will help.
Your high load and my high load will vary.
When it comes to high load means the adaptations of place too much too soon.
So I have seen in Indian Arkin book itself, high load will cause damage. Everyone read that and misunderstood.
I think body has a very great capacity to adapt to it.
If we go and see 10 people walking around you, you can find n number of biomechanical deficits in each person.
Oh, as a therapist, when they come also, no, we also say, so you have scoliosis. One side it's more elongated, one side it's shortened. Think, like the person is not even having a problem.
That is when biomechanics itself misunderstood. We have studied in that you have to bend in this way. When you squat, knee should not go for valgus. So we believe that's the biomechanics. Actually, what you know it's biomechanics, not the biomechanics. A missed component when it comes to biomechanics, always feel neuromotor. Biomechanics book, we studied one chapter which is posture.
Like sitting is a posture, standing is a posture. It's not like that. Running is a posture. Like we are
Squatting is a posture, walking is a posture. If posture can be a problem, then when?
So a person, until they don't have any pain or disturbance from their lifestyle, they don't even question about, my posture is correct or not.
That's
Maybe after correcting the posture also, still the pain may persist.
He unlinked the association between the posture and pain.
Blaming my arch of the feet, my posture, my position is not good. That's why I couldn't able to perform. Then just think about the para-Olympic. A single muscle can be activated. A single muscle is a reason for your discomfort or pain. What do you explain to them?
We can't activate single muscle first of all.
Hi everyone, welcome to our third podcast, which we are going to discuss about commonly misunderstood things in physiotherapy. அப்படியே நீங்களாம் கொஞ்சம் ப்ரொஃபஷனலாக அங்கே பார்த்தேன். நல்லா இருந்துச்சு அப்படியே வச்சுப்போம். நல்லா இருக்கும்.
இல்லை அந்த குட்டி கேமராவா இல்லை பெரிய கேமரா?
இது. So welcome to EP Classroom third podcast. I don't think so we need to introduce all of us because already it was introduced in previous two podcasts. And if you missed to watch, in first podcast we discussed in detail about that low back pain, how to assess in detail, and treatment part and so many things has been discussed. And part 2 we discussed about shoulder anatomy and biomechanics in detail, and followed by shoulder condition, how to diagnose and treatment supposed to come. There is small technical issue, so that maybe that podcast comes forth after this podcast. This podcast we are going to discuss about in detail about unpopular opinion and misbelief things in physiotherapy field, and what need to be addressed. How can we change the way we think to improve our clinical practice? Let me start with the most popular one is biomechanics. Okay, is it my question is it biomechanics matters in a clinical practice? If yes, then how much, whom? If it is no, then why, how much, whom? And what is overcomplicated so far? I'm expecting those kind of things from you all.
So starting from the first question you asked, does biomechanics really matters? And to answer this, I'm going to go with your style. It depends.
Depends.
And context matters.
Okay, it depends, context matters. Answer next question. Okay, continue.
So that is the most realistic and very reasonable answer it can have. But now we got to explore more about what it actually means. That it depends and
see, every question, Malati, it is like if the posture matters, there is no right answer, single right answer. The answer comes depends. When you talk about myths or misbelief things, is it special test matters? Yeah, it depends. A single right answer is depends.
Yes.
Is it pain is equal to tissue damage? Yeah, it depends. Give me a context, I'll answer. So maybe if you check out my Instagram DMs of whenever I'm going to reply, most of the students and physiotherapists or common population comes and asks the question, this is thing, what to treat, how to treat this and all. I already kept it in the saved reply, it depends. Saved reply, it depends. I will click it depends. Yes, seriously. So almost someone asks any questions, whatever we are going to talk in this whole 1 hour, 1.5 hours podcast, whatever, the answer is depends. If you am saying this is not going to be, which means it doesn't mean it's not going to be. it can useful for someone. Stretching, when you take stretching doesn't matters. Yes. Why we are saying stretching doesn't matters? Because most commonly everyone is going in the path of stretching is only way to improve flexibility. Because most unpopular opinion we are breaking, so we are saying no, it doesn't mean completely no. So 90%, 99% of the people following something, this is what is right then. So saying no could be a right answer at the time. By meanwhile, we can also say that it also helpful for certain population. That 10-15% population, not the 90-95% population. That is when strong opinions are coming out. So you're so much believing into special test, you're so much believing into MRI, you're so much believing into posture, you're so much believing into gait cycle, you're so much believing into should not bend forward, you're so much believing into disc bulge cause back pain, you're so much believing into someone coming with the complaints of pain, it has to be some structural damage. But it is all true as well. When we say myth and we are breaking this is not then, to make you understand there is another spectrum of thinking. So now we can continue.
So biomechanics means actually how the forces are applied to the body. So that's it. It may be internally or externally, whatever. Internally, we need to adjust the joint position and our mindset and everything matters. How we are ready for the force and everything. And externally means the bar grip and some things extra like if I get the good hand grip means I will take more weights.
Yes.
So this is externally. So so Malti said that depends. So I want to answer for the depends. So if someone wants to take his baby from down floor, no need to follow all the instructions.
Actual biomechanics, which is explained in the text.
So already the natural adaptation, what he learned from his young age or childhood, okay, it's already
it comes naturally.
It comes naturally. It comes naturally, and also for him it's very low load. Only 6 months baby, so I can easily bend even in flexion mode or
to
even
confuse
extension
audience to confuse audience more, when it comes to a low load, high load, which is an important component for biomechanics. So 6 months old baby, which is low load or high load, based on the context.
I can actually, but again I'm saying he is a father.
Understood.
He is a father, but if he have any condition, already any previous injury or something related to any low back pain or something. So that time maybe that 6 months baby, which means 10 kg. Okay, that is maybe more load for
6 months baby 10 kg.
இல்ல அவங்க கொஞ்சம் கல்யாணம் ஆகி குழந்தை பிறந்தது.
Sorry.
இல்ல no problem. 6 months baby comes around 4-5 kg. It's okay. அதெல்லாம் தப்பு இல்ல. Mathematically. எடிட் பண்ணவன அப்படியே போடுங்க. நல்லா இருக்கும் ஜாலியா. Okay. Correct Hema, but every human have a tolerance to lift 5 kg. But here biomechanically that is high load, that is why you couldn't able to lift. It's not the case. What actually believed, lifting with this spine, this posture will create the excessive load in that spine and the structural area. So change the biomechanics. This is a proper way to do it. So biomechanically people are thinking like that. But lifting 5 kg, everyone's cup of tea. Everyone's cup of tea. Here biomechanical fault will not create the pain or infaulty something like that. Here a fear, past pain experience.
Understood.
That is what it was actually creating a pain, discomfort and myths around it. So to answer the question, biomechanics that matters in, I will try to explain myself. When there is a high load, competitive in nature, really want to achieve something.
So when biomechanics really need, so I'm going for one competition. So that time all the person's need is same, which means the demand is same. So if I want to beat him, okay, so my competition person, my opposite person can lift 110 kg means I need to push more than that. Okay, so that time I need a
technical efficiency, biomechanical efficiency, physics and force variation of the muscle,
the engineering efforts, everything I need.
reducing the energy leakage, preparation for it, those things called biomechanics. For an example, you are saying, I will add another example to make them understand. In 100-meter sprint, first 20 meter head in upright position, efficiency will goes down. efficiency will goes down, and you're as much as ground contact time, as less ground contact time in each and every single step as possible leads to accelerate the speed more. This is called biomechanics.
For this, I have seen a video like sprint training. There will be a lane over like this. So they had to put their head down, and then only they can while the ramp is going.
So generate the force. You have to keep the center of mass as low as. This is a biomechanics.
Yes. Got it.
Application of physics into improvising the performance called biomechanics.
Yes.
And I think, see, to increase performance, you need biomechanics. This is what you said, right?
Yeah,
In
we're trying to say
printing and
definitely,
all.
yes.
So, I feel for doing high load activities, biomechanics will help. We need biomechanics. For example, if a person just jumping from very far thing, then person is jumping means the person can't jump in one hand, right? Person can't jump land in one leg.
Okay.
That time with high force, so we have to distribute equally. So that
All
time
joints.
biomechanics help because more
More
force.
knee flexion,
Yes,
more
you have to land
transflexion,
on both
absorb the
legs.
force and everything.
If the load is very less means, however you want, you can land. That is not going to create that much problem.
Something
So
Yes.
the major discussion point is biomechanics are needed or not determined by the application of load. So you can categorize into two spectrum, low load and high load. Low load and high load. So I'll talk high load first because I have seen in Indian Arkin book itself. Maybe if possible, I'll add the picture in this video. High load will cause spinal damage. High load will cause damage. That word. Everyone read that and misunderstood. Your high load and my high load will vary. Everyone's high load will differ from each other. For me, 20 kg can be high load. For you, 100 kg can be high load. For 510 kg world record person, Thor, for him 515 kg is high load. Even though high load can be divided into two aspects. Yeah, you add a point here. I will come to this.
Yeah. So nothing. So when it comes to high load means the adaptations plays a major. Too much soon, too soon. So when we are
great.
So I can able to lift 80 kg. Okay, then okay. I calculate the RP and something. Okay, I have a more confidence. Then I need to the same day I need to lift 90 kg and 100 kg. I can't suddenly my tissue adaptation is not that much.
We have to give enough.
Enough time and recovery. Everything is plays a major role.
That is when.
So that is also one of the reason for getting pain or injury or something.
Exactly.
So you need to address that also.
Exactly.
So
Yeah.
So it's like the tissue tolerance, how much the person is having. When the person is reaching the maximum limit of tissue tolerance and it is about to go for a breakdown, like in a fracture or a muscle tear, actual muscle
Great.
tear, that is when the biomechanics will be actually playing a role.
Excellent. So
Actually, whenever an injury is happening in the body or any modification is happening in the body, I think body has a very great capacity to adapt to it. So it will do its own compensations. We can't modify few compensation. We don't know by ourselves. So a person, until they don't have any pain or disturbance from their lifestyle, they don't even question about, my posture is correct or not.
there's a similar
Am I doing the
example.
right
That 6 kg load, the person could have been lifted in number of times in this life.
Yes.
After getting pain, it becomes difficult due to the words. We'll discuss that also. That is when I was trying to explain law of initial value. Law of initial value says most of the humans, see, you or 4, we can take an example. First time when you do deadlift, how much you did? 60 kg. You
30 kg.
30 kg.
40.
Around 30-40 kgs. You people are, you never did a deadlift. Can say never did a deadlift, right? You are almost all of us average value comes 40 kg. Can we say? So most of the humans have a capacity. We are not utilizing the capacity. Utilizing the capacity. That is when the deconditioning was happening. The capacity to tolerate the load is getting down. But naturally, when you born and you are running a life, sedentary person also, you have some capacity to tolerate.
Baseline.
Baseline. Some around on average 40 kg, every human can do deadlift.
Yes.
On average, 50 kg, 40 kg squat everyone can do. On an average, or 15 kg at least we can push.
Yes, of course.
Push. These are all the common things. Common thing can happen. To add the point, that is when what I am trying to say. She had a point, right? When you are exposure to that load, at a single time you can't increase into 100. Okay, you can go to a maximum limit. You can go to find the maximum limit, understand and improve your technique, movement experience. Oh, to add more points, I think I'm going too long, but still, let me finish this. See, a person, see, when it comes to biomechanics, we have studied in the biomechanics book that, so before I think, what is law of initial value? Beginner will improve faster compared to experienced person. That experience and beginner part only I'm trying to explain now. So every movement is a technique. In biomechanics book, we have studied that you have to bend in this way. When you squat, knee should not go for valgus. These are all the things we learned. You have to sit in this way. In posture chapter, we have learned this biomechanics. So we believe that is a biomechanics. But a person who never did a overhead squat in complete life and trying to do the overhead squat in front of you for the first time. NASCM book, you have seen overhead squat assessment. This muscle, the person hip is shifting towards right. See, this muscle is weak, this muscle is tight. Ankle is going more forward, hip up and down, knee in and out, ankle. These many structural, and that is what commonly believed. Oh, after learning that, we will be in it. We can find every mistakes in human body. Every mistakes in human body. So in that context, in that situation, if you take a person who is doing first time of that movement, we can't find any biomechanical fault because body experiencing that movement for first time,
and we need not find it.
We did not find it, but we don't know that is what was the capacity of that individual to tolerate the load. Situational factor also, that task, individual environment, and so many other factors. Nothing we don't know. So we can't judge anyone. First, person who do the same squat, a practice for a 10,000 times or 1,000 plus times, then the movement become easier. That time the movement cannot go wrongly. He can execute perfectly within limited load. That time also person can knee goes valgus. That time also person will perform the movement difficult, not properly. If there is a high load placed on it. When I mean high load is actually 100% or above 100% capacity of the individual to tolerate the load. Placed on it, technique will break down. So understanding that physics, biomechanics, force production, programming even accordingly to improve the tolerance and adherence itself for biomechanics things. But not doing that just by looking at saying that this is wrong.
This
It
is
is
right,
not
like that we can't say.
right way to explain.
And coming to that, if we are trying to find a biomechanically, a difference, biomechanical deficit, if we go and see 10 people walking around you, you can find n number of biomechanical deficits in each person. So that is not what is required. And coming to the technique, only when it is in the initial phase, right? In the initial phase, to learn about the movement, we need the technique. And as the sessions goes, and as sir mentioned, like at the end, when the person is going for failure, more than 100% of their intensity, when it is going, so to improve the performance, we can go for the exercise techniques to make it better, make it more efficient way of moving. So their movement efficiency, all those will come under the biomechanical aspects, not for a general population who doesn't at all require
Exactly.
Actually, in a normal population, when we see a people walking, as you mentioned, right? So we can see like everyone will not have same supination, same pronation of ankle. They walk in their own pattern. So why I say this is symptom modification, because of the pain or something, they just modify their version and they walk comfortably. So I can't say like, see, you're pronated, you say change your shoe or something like that. I can't say them. So same ways, this is in walking, but same ways in lifting or any I even say when a two person is doing bench press and both person are doing 30 kg bench press. One is doing very efficiently thoracic extension, everything is doing perfect, and one is lifting it very effortlessly, very easily. He didn't do any technique and all. He is doing it. That doesn't mean so maintaining thoracic extension only will be a very good bench press. We can't say that, right?
No, Ramya. What I would say, if both person performing in a competition, for an example, to improve the biomechanical efficiency and technical efficiency, if you follow those things, you can push little more.
Yeah, performance oriented, that is better.
So biomechanics needed for performance.
That's got it. So, but on a normal population, when they
become a healthy, no need to.
We don't want to assess that much. That's what I'm trying to say. If in a
So
normal
your
population,
saying that a power lifter who is bench pressing with proper arch and following a technique, wider grip, and someone is lifting and squeezing the scapula, pressing the leg on the floor, grinding, lifting. Not necessary. You are watching that reel. You are a person, don't have any goals in your life that to go and compete like that. Just you are going for a gym to improve your health. No need to follow that.
Exactly, because as a patient
For
also,
you, biomechanics is not so superior and necessary. You will get adapted to complete the task, whatever you are doing. Perfect.
because patient feel that, right? I'm not assist properly. Assist me correctly. Guide me. Give me clue. That's what
Most of the gyms are running in terms of as soon as you join the gym, and they will come, they will assess your posture and everything, like NSCM book, what I have said, everything they'll assess, they will find 5, 6 mistakes, that's the rules in every gym. Then only the fear of the client slightly get increased, they'll convert it into PT.
personal training. Okay.
This is what in a gym
So
field
that's
is
not
happening.
needed because in biomechanics it doesn't matter in that aspect.
So,
And-
yeah.
And biomechanics feels more like using common sense rather than actual absolute science sometimes. And sometimes biomechanics does matter in a general population. I don't know whether it is actually right or not, but we know that doing posterior pelvic tilt and neck flexion can improve can be associated with the lumbar flexion. So this thing is somewhat related to biomechanics, and it can be used in a treatment for general population too. So when a person is having fear associated with forward flexion or lumbar flexion, we can use this, right? So we can encourage them to go for a posterior pelvic tilt, and along with neck flexion, we can encourage them to go for a lumbar flexion. So this is the way how we can use biomechanics. It is not complete crap.
Ma'am told one point, symptom modification.
Right.
Person came with a pain, so we can at least regress the exercise, progress the exercise. So for that, instead of giving forward bending or Jefferson curl, we can go with cat and camel, basic child pose exercise.
So which means graded exposure to that moment. You don't need much of biomechanics into it. You don't need to follow if you're trying to follow biomechanics and giving the feedback to the patient that don't bend forward like this, and your spine has to be like a rod, it has to be straight. And
one more thing, the biomechanics is only from our side. They no need to follow for a prolonged period of time. So we need to know the biomechanics, how to regress and how to progress. We need to comment on that.
Your spine doesn't know anatomy biomechanics. Your shoulder doesn't know anatomy biomechanics. Your knee doesn't know anatomy biomechanics. They know my owner, my boss, us with the central nervous system brain. Given the task to complete, I am completing the task. However, I can, whatever the facility I have. If the person have a facility to generate more force, I will utilize better. If the person have less ability to generate force, I will how much ever it is there, I will utilize that. So the task has become heavier, then body will definitely complete the task by using other supporting muscle group. Load, increase, decrease can happen everyone's life.
So do you remember, like we saw a patient, like he feels like he's having scoliosis. But the thing is, he doesn't have any pain. His movement is all better. He's doing exercise very well for a long years. He's all good. But the person who others see, they say your spine is not good. Go and check. So that is what. So as a therapist, when they come also, we also say, so you have scoliosis. One side it's more elongated, one side it's shortened. So these kinds, in this person, think. Like the person is not even having a problem of pain or discomfort. In this case, you don't want to correct the posture or something.
Yes, until necessary.
Yeah, so, because here biomechanics doesn't matter at all. He's all good. He doesn't have just cosmetological here.
As just now, Hema gave the point to add. Hema, if you know her, if you look at her running form, it will be very bad. If someone who is running regularly, if you look at from any...
Not a regular biomechanical running.
Definitely not a regular biomechanical running. If she give permission, I'll add her video in this corner. Definitely, because when we try to run, many runners who could have come and explained to her only, please change your running form. But she can walk as long as possible, she don't feel any pain. As soon as she's running, she feel discomfort. Increasing the speed will cause more discomfort. So, the capacity to tolerate the load will determine when you get how to get the pain or not. Yes, the thing is, she don't have running experience or exposure. Once she started running regularly, that 5 km, 10 km, she can adapt it. Initially, even a 5 km caused pain. Here, what do you blame? So, I'll reframe the question. See, Hema is a person who is running, as soon as she started running for the first time in her life, she felt a pain even 2 kilometers, 3 kilometers. She felt a lot of difficulty because left side hip goes like a circumflexion. Hip flexion, reflection only will not come to her. We have seen, right? So that is a scenario. 2 kilometer, 3 kilometer, she did. She has pain. Do you expect her to correct your running technique and then come and run, or else just run by running itself you will improve? What do you suggest?
If she want to be in competition or something, she wants to achieve a personal like within 30 minutes I have to complete this. If she have a minute like that, some targets like that, then she can improve.
She has to work on that biomechanics, A skip, B skip, something like that to efficiently. She have to practice.
Just by she want to be active, she's just doing as a physical activity. That's not matters. Without pain, she can.
That is what happened to her. That's what happened to her.
Pain is limiting her running means definitely we have to work on it, right?
Yeah, when pain will limit, for an example, your running ability. When there is a specific goals to achieve in short period of time.
When there's no target itself, no, she can run anywhere,
For example, I want to improve my health. Yes, whenever I run 2 kilometers, I have small discomfort. Just get the clarification. There is structural pathology, nothing serious in nature. Just the exposure of the load. When you give an exposure, for an example, a biceps curl, when you're trying to do 10 kg biceps curl, can't able to lift first time. But you started with 2 kg, 3 kg, 4 kg, 5 kg. Similar thing adapted to her running technique. Yeah, squat example, as I said. First time squat will be not good. And see, that is when the neuromotor things comes into a picture. See, our brain will give us signals to activate this muscle to coordinatedly or synchronously complete the task and movement, which is her own way to complete that. She's doing for regularly, and she's improving too. And 2 kilometer pain is become 3 kilometer. 3 kilometer pain become 5 kilometer. 5 kilometer pain becomes 7 kilometer. But you have time here. You don't have a specific target to achieve. Just you are focusing on your health to improve. You're not hurry to achieve 5 kilometers in 30 minutes, something to win a competition, something like that. She has time, so don't overlook biomechanical fault. Don't increase the fear at the time.
Let the adaptation do its work.
Yeah, let the adaptation do its work. Perfect.
Like when I try to correct it, it may cause pain also, right? At times.
It depends again. It depends on that variability. What biomechanically she is doing wrong. Why her hip flexion is not coming so high?
That's not at all a problem, but when it comes to marathon or something, when she trains only, she get that problem itself now.
So many people is living their life like that. She tried, one person is trying, so they are coming up with pain. So everyone has the force production difficulty. When we test also, can you rate that which hip, how much force deficit flexion is?
Left side. Left side only 9 and this side I think 16.
16. So around limb symmetry index 60% left side. 60% only she has 40% strength deficit.
Force production is not good. Yeah.
You can, for an example, again, measuring this force production, how much muscle can do is biomechanics. Application of physics into principle and training. Not like just, your hip is up, down. Biomechanically 2 centimeters. That is not biomechanics. We are trying to tell you how can you look in a biomechanics. Actually, what you know it's biomechanics is not the biomechanics. Actually, biomechanics is application of physics into human body in detail to improve the performance or ability to tolerate the load. That is when the biomechanics mostly useful in a sport population on high demand activities. Want to improve the performance more and more, it is highly required. Normal healthy individual, no need to increase the fear or something like that. Just let them do it in their own way, your body will get adapted. And normal patient with the pain, no need so much biomechanics.
One more myth I want to add here because it's more similar what we speaking right now. So if I correct the hip flexion, now you mentioned, right, this side is not good and this side is very poor. I want to this much percentage.
Poor in force production.
Yeah, poor in force production. So I want to train that only muscle, then my performance will improve. I can't say that.
You can't say that also. That is not an answer for that question also. Along with it, you need running practice as well.
So we can find a mistake of force production or something in alignment, whatever it is. But if you're correcting that only, we will not expecting the performance will improve or your target will improve. You can you can go. We can't say that. So that is what I want to say.
But can you tell me, like if you am giving exercise for your hip flexors to strengthening hip flexors, that's not wrong also, right?
That is not wrong.
That's
the
part
only
of
thing.
the-
The only
Yeah.
if you
It's anyway, it's going to improve his performance.
It will improve, but expecting the improvement only with that.
And also, you can't say the 100% go. Hereafter you will not. Yeah, hereafter you will not get the pain on your knees. Just go and run. We can't
That
say.
can't happen.
So everything has a primary factor and secondary factor, tertiary factor to contribute. When it comes to primary factor, doing the same thing to improve the performance, like a specificity principle. If you want to better at javelin throw, you have to do throwing. You want to better at running, you have to practice running. You have to better at bowling, you have to practice bowling. See, I can add a person who can bench press 100 kg easily cannot be a good thrower. A person who is throwing 85 meters javelin cannot be a good bench presser. But a javelin thrower, to improve his efficiency, primarily he has to practice and he work on the technique, biomechanical aspect of where should hold, how much I should rotate my spine according to my own biomechanical things. He has to work to improve by only throwing practice. It's a primary.
Sport specific adaptation.
Sport specific adaptation. That's why that's primary. Doing bench press is secondary for him. Bench presser to improve the force production. Doing bench only is a primary for him, and doing some plyometric throwing something like is secondary for him. So that's what said by said principle.
Specific adaptation to imposed demand.
Same when you're talking about specificity, I have to activate specific muscle groups means I need biomechanics, right? This muscle action is this. So I have to activate this. For example, in 2022, one research published that a person who had ACL injury, there's a chance for most compensatory strategies. It lead to compensatory, some compensation, interlimb compensation, intralimb compensations after ACL injury. So to avoid that compensation during functional activities means I have to targetly activate some specific group of muscles.
Which has been wasted or not utilized after surgery.
Usually with ACL it would be quadriceps, I guess.
ACL, one of the best example we can give. You can prove that biomechanics are very important. Of course, right? ACL is one of the best example we can give. So now I can add one more point. When biomechanics matters, when there is structural specific pathology or injury post-surgically something, biomechanics plays a role. More of specific force production, specific group of activation, specific targeted the function to improve. That is when ACL injury we assess force production repeatedly, jump performance repeatedly. That is what the criteria for return to sports as well. One of the criteria. So when there is a structural pathology injury post-surgically, biomechanics matters, comes into picture more compared to non-structural. We can say rotator cuff related shoulder pain, non-specific low back pain, just to load capacity mismatch related, so just a pain, not a specific diagnostical term which we need to diagnose. Those kind of situation, biomechanics should not that matter. A person has also don't want to improve much performance, something like that. Here again, high load, low load comes into a picture again.
And to improve performance.
Yes. So to add more point, most missed component when it comes to biomechanics, kinetics, kinematics, everyone talks. What is kinetics? We are not in the lecturer classes to explain what is kinetics, kinematics. Hopefully they will go and refer, and they might have studied already. And missed component when it comes to biomechanics, I always feel neuromotor. What is neuromotor? To short explanation, your motor learning. Motor learning. As we all discussed, when you are learning a skill newly for the first time, your brain, central peripheral nerve system signaling, exact muscle fibers are activating to complete the task, will not coordinatedly work. Okay, so just 4 days back we went and played pickleball, and we are watching someone is playing, the accuracy was good, playing is good. When I play, we are also trying to do the same thing, but its coordination and movement is exactly, placement is not coming. But consider I was playing for another 2 months, I can improve slightly. Consider I am playing for another 6 months, I will improve little more. Another 6 years if I play that, I'll become very good at it. Very good at it playing, right? So how much ever that 3 things, right? Cognitive, associative and autonomous stage. When you practice 10,000 plus times on single movement, naturally it comes to you, right? The thread coding, firing and everything will happen quickly, right? That is the most commonly misunderstanding in biomechanics. No one takes that. That is the most common biomechanical aspect. You should definitely understand the biomechanics. If you understand that, you understand technique is necessary or not, right way to move is there or not. We can answer certain wider spectrum of that answers and question. Because that 6 years of playing pickleball slightly take me into that the third stage, autonomous stage. Autonomous stage. So what are all the things will improve? Movement variability will improve, experience will improve, muscle fiber activation will improve, coordination, efficiency, motor control,
Rate coding.
Without even thinking, I can do that shot. So accuracy, everything will improve, right? That is what actually biomechanical way. So which means to give a better example in Indian population, cricket example if I say, bowling is a task. We all look, this is how you should complete the task. Bowling is a task. Each and every person their own way to solve the task. Someone, Bumrah will bowl differently, Malinga will bowl differently, Bhuvneshwar Kumar bowl differently, just Jimmy Anderson bowl differently. Right? Each and every individual bowl differently, but they are trying to complete the task. They are trying to complete the task in their own way. So now here biomechanics is not like robotically how to bowling like this. For an example, one YouTube video I've seen, basketball coach who is teaching to that students to prevent ACL injury, this is how I should land. How can you expect in the match?
No, it can't happen.
Everyone have their own way to solve the task. Initial few times will be tougher. Your motor learning, movement experience and training experience gives excellent adaptability to that movement. Adaptability to the movement to tolerate the load as well. Because you experience multiple stimulus of load in that aspect area, so your body is also adapted. This is also called biomechanics. Very important aspect of the biomechanics. Once you understand that, you will understand every individual have their own way to solve the problem, or own way to solve the task. Actual biomechanics for Bumrah, if you have seen 2016 when he debuted, and now his bowling action itself have some slight variety of changes. Biomechanics also can be differ and change for a person to person.
And the
According
same
to their
person,
own technique.
Same person also it will change.
Yeah, according to their own technique, technical corrections will be for that person. See, one excellent biomechanist working only from cricket, he can't be excellent biomechanics for running.
Any other sport. Yeah.
Yes, of course he can, but running related biomechanics is better for that. What I was trying to say, it's an endless spectrum of learning curve. Which movement you are spending most of your time, your learning experience also will be in that only. What I was trying to say. So don't forget the neuromotor things. So always the motor learning principle which we learn.
About the motor learning, so it is also, as the point you have mentioned, I would like to emphasize on it. So one part of it is making the movement efficient to the person, and movement efficiency will also be varying from person to person.
Yes.
So why the techniques are getting different for person? The person is trying to complete the task in the most efficient way for themselves. So the movement efficiency will also be varying for person to person. That is where the biomechanics actually varies.
Great. Excellent. Now, anyone want to add any more points related to biomechanics? So I think if you want to add, I can add that is it right way to move or wrong in biomechanical aspect. I think I have uploaded the detailed video regarding that. I think I will add here. So click here and
So I have a doubt here. The thing is, see, yes, Malinga's and Justin, Bumrah's bowling is different, but bowling will have a particular rule, right? This is how it should be.
Yeah, they were within the limit of rule. So what is mean by techniques following the rules? Within the limit, for an example,
Following their rules in their own way.
their own way. They are not rules and things or regulations which is created by that bowling cricket They're following that. They are allowed to do that.
Within that they can do anything.
So here spectrums are very big, but we are narrow downing that. You have to do it in this way only. See, even Yomif and Sebastian Say. These are the two people in this world who completed that marathon under 2 hours. Recently, this London marathon. Under 2 hours, it was believed 4 or 5 years back is unbelievable thing. Okay, both running form was different. Sebastian Save running with midfoot to heel. Yomif, who come to second place, just 10-11 second margin, he is running completely 4 foot.
Okay.
See, elite runners who have a world record of first and second most toppest runners who created the world record, they are both running differently to complete their own task. What efficient for them? But a person who is having a pain, and they are correcting their running technique. I was not running in this way, that's why I'm getting pain. Not understanding the load capacity. How much I'm programming myself, how much weekly mileage I'm increasing. My tissues have tolerance to tolerate that load. As I said, running is the primary way to improve his running tolerance. Add secondary way to adding strength training to the muscle to improve the running efficiency.
I would like to quote an article over here. So it is a systematic review done in 2006, long back. So that studied the incidence and determinants of injury risk in long distance runners. And it has said, like, the greater association was with training volumes, how much distance they covered in a week, all those things. But little evidence, very limited evidence was there for the other determining factors like biomechanical factors, lifestyle factors. All those are very limited. The contribution of those factors are very limited. So blaming this biomechanical difference to be the cause for pain is absolutely...
That is when everything is getting misaligned. So what I feel genuinely not understanding pain science properly. It's become biggest problem. Being a physiotherapist, after passing out for 4.5 years, we trying to diagnose a person, right? We have to say something, this is the reason for pain. Because that will be curious, because once you become experienced only, once you understand things slowly, you start realizing we can't actually say a single diagnostical term, this is what causing pain. Because lack in understanding of pain science, lack in understanding of human behavioral changes, what leads to find the biomechanical fault is the reason for pain. That is when biomechanics itself misunderstood. Highly misunderstood. So my question is to you all next. In biomechanics book, we have studied one chapter which is posture. Okay, so before starting talking about the word posture, every audience know exercise prescriptor what we think about posture, right? So I'm giving clarity to them. Posture, what do you think posture? It's not the posture. If posture is matter, yes I say. But not in your thinking. What is there in your mind? What is there in your mind? It was in a different context. Now explain me how a physiotherapist should take that posture chapter into real life application.
Okay, I would start this off with actual definition of posture.
Okay.
So that is one good study. I loved that article. It's actually a literature review that was in 2017 by Francisco Carni. So it was, the review was about posture and posturology. So and the words I would like to quote on here from the article itself. Posture is defined as the position of body in space, and it doesn't stop there. It gets
exactly. I'm looking for what is posture. Perfectly explain.
So it also adds on. It is a automatic, unconscious positioning of body, and mostly it is a representation of body's reaction to the force of gravity. And I love that kind of, and it also adds on. Posture can be defined as a position that is meant to maintain a balance with greater stability, maximum stability, minimal stress to the anatomical structures, and minimal energy economy, minimal energy expenditure. So I think that makes the concise summary of all the ideology on posture.
Which means we always have a myth like sitting is a posture, standing is a posture. It's not like that. Running is a posture, like your
squatting is a posture, walking is a posture. Gate cycle, and the chapter nama pesam. Very bad chapter. See, So we can add that everything what you studied influenceable by various factors. Once you understand it influenced by these many factors, then you can apply the context and take a decisions. Climax la பேசுறது summary இப்ப சொல்றேன். It's okay.
So one person, I think Peter O'Sullivan, he's mentioned 2012, this quote, trying to maintain a good posture can be the painful posture for any other posture.
Okay. So having good posture is most discomfort posture. Uncomfortable.
Pal itself, he unlinked the association between the posture and pain.
Great.
But still, we are struggling to explain.
No single article to support your forward head posture lead to neck pain, your anterior pelvic tilt lead to back pain. No.
So
Scapular disc initially lead to shoulder pain.
So most of the people believe that because of this posture only, I will have the pain. This is not a problem for me as a physio. I'm not a bother about it. But as a physio, some physios are trying to. This is the direct cause of the pain.
No.
The direct word is a problem for me. The direct word is a problem for me. Let me explain with an analogy. So imagine one street, there is a 10 houses. Okay, one wave is sitting over there. The 3 houses were collapsed. Okay, if I ask one question to you, why the 3 houses are collapsed? So you all will say because of that huge wave. So think differently. Why the remaining 7 houses are standing? Why? Because of the strength and because of maybe it's new. The many factors are there. So
they build it.
Yeah.
Super.
So what I'm trying to say here, there's a no link between the posture and pain. So consider that wave is a posture, okay? The wave is a posture, and the 3 things are collapsed means because we can't withstand the wave. We can't withstand the force of the wave. The 3 houses. That is why it's collapsed. It's not because of the wave.
Okay.
Not just because of the
wave.
not
Just a force.
Yes.
Can we say wave is just a force?
Yes.
Force applied to all of us same way. Okay, who can tolerate? Who didn't collapse? Who can't tolerate? They collapsed. Simply. So again, we're coming to the concept of your body ability to tolerate and withstand the load which externally produced. Right. So if it is not good, your body will find own way to change and complete it. Again, we're coming to the same point. So body knows the right posture. What is for the next to the body.
Coming to this point, so there is a common and a very famous saying and very unpopular too. So the right posture is the next posture. So whatever is comfortable for your body, the body itself knows. So, and as I mentioned in that article, it is an automatic process. It should be unconscious. So when you are trying to maintain an ideal posture, you know it consciously. You are making ideal sitting posture. That itself breaks the rule of what the posture is. So it is as Sir mentioned, neuromuscular system will be taking care of it. So you don't know what is the next right posture for you, but your neuromuscular system does. So your body has lot of sensory receptors like proprioceptors are there. It does know which is putting more stress to your structures. So it will try to eliminate the stress. So to shift to another position which is less stressing the structures. So your neuromuscular system does know about it. So let it do its work.
I think there is no research says that correcting the posture is helping to reduce the pain.
Exactly.
Maybe after correcting the posture also still
They may
the
have
pain may persist. Yes.
So I'd like to add an example. Like there is a person who's doing desk job work, okay, and there is another population who drive auto or cab or something. Both are sitting work, okay, but they both have different lifestyle. Okay, one may be active or inactive. That's wrong. That's a different aspect. But the thing is, both having a occupation of sitting. Okay, so the thing is, one is getting pain, one is not at all getting the pain at all. So here, when there's a problem arising in this case, we can't say that you are maintaining this posture for a long time. That's why you get the pain. We can't even say that. So because here other factors plays a very important role rather than holding that posture for a long time. Okay, so I also have this doubt. When the patient say like I sleep very straight, I won't even turn, ma'am, because I'll get pain when I turn to the other side. How can be that conscious when you're on sleep? It's not that means you're not in a good sleep. You didn't even turn it. You're not in. You didn't even sleep, man. Yeah, please sleep very well. So I suggest to all my patients, like, please, what is comfortable? Please lie in that. Without pillow, with pillow, in down on the bed. Please lie.
And again, I want to talk the biomechanics. Why? Because we are overconscious the biomechanics in foot marking. So you need to choose the perfect slipper and also the bed mattress and everything. The over biomechanics. So when you understand about the over biomechanics, also that is very wrong.
And something like people roll the towel and keep it in my ears and my pain will go off. That's nothing like that. Please relax. You don't think this much. This is only causing a pain. This is what.
For this case, expected treatment, postural correction. Reality, sleep well. That's all it.
And also the thing is, I have seen patient like having medial. If I put medial lash, my foot pain will go off. That's what they get. The thing is, even many people with fat feet, if I increase the arch of the slipper, no, they don't feel comfortable at all. They'll feel that is causing me pain. They adapted to it. So they like there are many treatments like foot reflexology, where they just decode. So I prefer like it can be a high professional shoe or something very low shoe. Doesn't matter. Which is comfortable for you, wear it. That matters a lot. It's not about the brand or the insole matters. That's different. Okay, rate wise, that's all different. But which is comfortable you, please wear it. That's nothing like only the medial arch is going.
Which is comfortable to you.
Yes.
If you want to sleep with pillow, sleep. Without pillow, don't sleep. If your two pillow is comfortable to you, use two pillows. If you want to wear shoes, wear shoes. Wear slipper. Bare feet. There is no single ideal right answer which is making you more comfortable. That is the right answer for your question.
And we know,
Perfect.
right?
So why we say that? Sorry, Kritika. Why we say that? Not to you, to your patients. How do you explain?
Yes.
Fine.
We know that Usain Bolt is having flat foot. He's having scoliosis.
Yeah.
And the person first time five
Yeah,
times
who
lifted
lifted,
having scoliosis. So
5 times body.
having some abnormal posture is not a barrier for you.
We've seen Instagram reel how many people are doing weird thing. One person doesn't have one hand on one leg and he's doing squat, creating a world record. So if you are going to blame that I'm sitting in just 3,000 rupees chair, that's why my back pain comes. I don't wear proper shoe, that's why my pain comes. Yes, when it comes to these biomechanics matters. When there's high demand of load, for an example, like that elite Kipchoge, that runners, Usain Bolt, Usain Blake, that Justin Gatlin, that much very very top end athlete, and that spectrum, that shoe matters. Biomechanics of the shoe matters. Biomechanics of the dress even matters to perform better. Yes, but normal day-to-day life activity, we're blaming my arch of the feet, my posture, my position is not good. That's why I couldn't able to perform. Then just think about the Paralympic athletes. If you are truly believing your posture is the reason for pain, just think about Paralympic athletes.
I think any posture, if you are maintaining for a long period of time, you will get some
Discomfort, your body will change as we discussed.
And as we were talking about scapular dyskinesia and scapulohumeral rhythm in previous episode, so a lot of factors will be determining the scapulohumeral rhythm. Just like that, posture can also be determined by a lot of other factors, like age, gender, how confident you are, your personality, and how much tired you are. Just go and search tired person. Just click on the images. You will see a slouched person sitting slouched.
So it's believed.
Yeah. So we cannot expect them to maintain an ideal posture always.
So your confidence relations related with your position, how you positioning your body. A person who is going gym regularly and confident and who are good attitude, then they feel looks military. Usually the belief system comes from the military population. They look confident and upright, and a person sad and dull, they look recently Messi picture also come on viral, that Messi was sitting like this. After a match, he's sitting like this. Even a world famous athlete have a bad posture. That meme was recently viral.
சாரி, வெரி inappropriate தான். ஆனா நீங்க இது சொல்லிட்டே இருக்கும்போது எனக்கு வந்து ஒரு காமெடி தான் ஞாபகம் வருது. எல்லாரும் பிரச்சனைனா இது எம்எல்ஏ
எனக்கு ஒரு பிரச்சனை.
எல்லாரும் depression இருக்கோம், சோகத்துல இருக்கோம்.
நீங்க சொல்லிட்டு இருந்தீங்கல்ல, ஈவன் லாங் பீரியட் செட்டிங் இஸ் ஆல்சோ ஹேவிங் பெயின். அப்ப ரொம்ப நேரமா அதான் சார் பார்த்துட்டு இருக்கேன். எனக்கு கூட இப்ப இங்க வலிக்குது அப்படின்னு சொல்லலான்னு வந்து திரும்பி இருக்கிறேன். அதுக்குள்ள
Another most common unpopular opinion which was single muscle, blaming a single muscle is the reason for the pain. Okay, and sorry, before moving to that, can we give some explanation to the audience? Yeah, if posture can be a problem, then when? How?
I would quote the thing you said in low back pain podcast itself. So a surgeon doing a surgery in this position, so it's been maintained for a long time, even though it is uncomfortable.
இல்ல இதெல்லாம் அப்படியே வீடியோல வரட்டும்.
Even though it is uncomfortable, he has to maintain. That is his job. So then it will be problematic. Maintaining that posture will be a reason for pain. Yes.
So posture can cause discomfort, which means body knows to switch the position when it causes discomfort, but your position is not allowed to change. Your position is not allowed to change chronically. Again, load exceeds the capacity. Because you're standing, your body slowly will change that position, and you go sit or you walk or you do something. But your body have some tolerance to stand. 4 hours I can stand. Beyond 4 hours it will change, or 3.5 hours it will change. But the situation is not allowed to change because my principal asked me to wait outside of the classroom, punishment for whole day. Okay, I can't lean on the wall or something like that, which has happened to me. 1.5 days I stand outside. Memories. So that time I had a back pain. So now I'm relating. Yes. That time I went and asked my professor also. Sir, I'm getting back pain. What was the reason? Do posterior pelvic.
You have lordosis.
He said you have lordosis. I believed that for another 4 years. Seriously, when I went to PG, then I was my belief system. Then I started doing strength training. I feel better. Tolerance of standing is getting better. I tried posterior pelvic for 3-4 years whenever I'm getting pain, not improved. But as soon as my force production of I started doing hip thrust, squats, lunges and everything, I can stand a bit more longer than without discomfort. See, this really happened when 2019 when I do PG, this really happened to me. I realized, okay, this is how completely I evolved and understand. Because I am also a person when you studies believe this all things. Okay. But lives give an opportunity to think. I'm changing my perspective and getting better. So go back and referring and improving myself. That's what happened to me. So hope we answered, right? Now we'll go to that question that the single muscle act, another belief system which we have, that the transverse abdominis. Then supraspinatus we have addressed in the last anatomic podcast in the shoulder. Someone, hope if you asked that could know that. So single muscle theory, what do you think about it? Is it a single muscle can be activated? A single muscle is a reason for your discomfort or pain? What do you explain to them?
We can't activate single muscle first of all. If you are doing any action, agonist, antagonist, stabilizer, synergist, everything is going to work, right? If all together coordinately work, then only you can accomplish the task. Even if you're not moving, just you are isometrically contracting also, synergist, antagonist, agonist, everything is working. So whether you are moving or not moving, all the group of muscles are going to work. One single muscle is not going to helpful.
But the primary mover, we call it as agonist. That's what
yes,
we
we
blame
that.
What do you think about post osteoarthritis surgery or osteoarthritis rehab or ACL rehab in knee joint? Usually VMO strengthening. That is why
I was about to.
So VMO is commonly blamed in the knee. Multifidus and transverse are commonly blamed in the abdomen. Supra is commonly blamed in the shoulder. Right.
Okay, let's go for this one. What are the commonly blamed muscles we know? transverse
நான்
abdominis.
சொல்லிட்டேன்னு நினைக்கிறேன். Multifidus, transverse abdominis, vastus medialis oblique, supraspinatus and quadratus lumborum, gluteus medius, hip flexors.
Tight hip flexors and fuel.
இன்னும் இருக்கே. Trapezius,
Upper traps.
sternocleidomastoid. I think serratus anterior.
Yeah.
God, it has to be activated. Correct. That is when context. Oh, bad. Okay.
I think
Pec minor tightness.
yes, pec minor tightness. If you're having knee valgus, usually people say we have to activate glute muscle to correct that knee valgus.
Sir, we also tried to post that, sir. We will get 2 million.
Already I got millions of views on video. I did this all things actually 5 years back. So I was one of my first video got viral. I think 2 million likes, which is I'm teaching how to release trapezius effectively. I have uploaded the video how to release pec minor very effectively.
Yeah, with the ball.
See, which means what I'm trying to say, which person who you are believing is good also did all the mistakes and corrected. So whatever we are telling, it is not to blame you, So everyone in that position and improved. God doesn't give a superpower to us to understand everything critical. Critical thinking developed over the period of time. On patient with why we are releasing, what was, go and study. Every day learning makes me better person. That is when the same topic, if you ask me to take a podcast for another 5 years later, I would talk something different in a better way. I won't change my opinion. Doesn't mean I will, maybe there is a possibility to change the opinion also. Yeah, 5 years back my opinion there, you can do release. It doesn't mean release is completely wrong. You can't release, any patient comes to you. What I was trying to say, I learned, I improved myself without even releasing that particular single muscle. I can make my patient better. You are not yet. Are you going to stuck with the same area and not going to improve yourself? Or else, are you going to improve from there? That's what I'm asking. That's when the experience comes into a picture. You have maybe 25 years of experience, but you're doing same thing. I have just 8 years of experience, but I evolved a lot. But I don't consider the 25 as an experience. If you're in the same way, same page, you're not ready to learn, unlearn, learn. We use that code very often. I think something good we explain now. Now about the single muscle theory.
So
Anything to
Hema
add?
was telling, right, like knee valgus to be corrected with
Yeah,
glute
glute
activation or
medius.
something. So the thing is, see, if I'm giving exercise, yes, I will just ask like, can you feel the particular muscle or not? Yes, I can ask that question. But the thing is, it doesn't mean that that muscle is on zero activation on the other time. The person have come by walking, yes, the glute is activated. With the glute activation, they
Glute was working when you stand, sit, padikate, stair climbing.
I'm just facilitating it. That's it. I'm just making it used little bit
So
more.
it is not called something is inactive. People, your glute is inactive. That's why you're getting pain.
You know this term. I don't know if you guys know this term. There is a diagnostic term for this. Gluteal amnesia. When I got to know this, I was like, okay.
Nothing called gluteal amnesia.
Amnesia. Glute forgot to.
How to work then? How you are standing? How do you stair climbing? How do you sit to stand? Nothing could have been happened.
you want stabilization, right?
See, then to answer this question, you can't activate a single muscle. So, group of muscle works to complete the task. Yes, some muscle group for some task will be more activated, less activated will be there for sure. Again here, maybe primarily you are trying to activate some muscle. That muscle, low tolerance may be lesser.
Which means that muscle
That is
doesn't
why
have-
maybe it was not carrying the capacity. Again, we are coming into that. Load versus
Load
capacity.
versus capacity.
the muscle have never felt that much load. That's why they're feeling that
Exactly,
muscle. It's
exactly.
nothing like zero activation. I made it 100%.
Exactly.
There's nothing like
So, give a movement exposure. Give a movement exposure, as we discussed in the earlier. Movement exposure itself correct their faulty techniques, which you believed, if it is a faulty technique. Yeah.
And about this single muscle activation, if that could be the cause for the pain solely, activating it, making it stronger, could have solved the problem. So there is a study, systematic review done in 2014 probably. So that study was analyzing the aftermath, like in a low back pain cases, how much changes in transverse abdominis and multifidus have got betterment in the outcome measures. So it was been found that there is no consistent evidence that changes in transverse abdominis multifidus activation is actually causing some betterment in the outcome in a low back pain case. So if this thing is not solving the problem, this is not the cause. So it is really very clear. Right?
And usually if a person blame weak core for a low back pain, right? Always. You are having weakness in the core.
But the core here, usually in a general population, whenever we talk about core, they get an idea that this is core. Abdominal muscles are the core. So it is like the anterior abdominal wall is only the core. Core by the definition itself is a rounded central area. So this central area, it has anterior, posterior, lateral, upper, lower walls.
So many things.
So core includes anterior abdominal muscles, lateral muscles, and
Not only your rectus abdominis.
the six pack muscles doesn't only the core. Your diaphragm, pelvic floor, everything comes in the core.
Doesn't mean you have 8 packs or 6 packs, your core is very strong. It doesn't mean you have seen a strong man. Strong men, they are big bellies, but they can generate more force in the abdomen compared to other person. Again, if you specifically practice, how do you assess the core strength also matter. There is no single specific way to assess something. For example, if I am saying plank is the best way to assess the core strength. Okay, and one study was find out that core muscle activation, the entire trunk muscle activation, which is a person with 6 arm squat and person is doing plank. Okay, both are equally activated the core muscle. Even posterior core muscle like rectus spine and everything more activated in the squat compared to plank alone. So which is considered to be what I was trying to say. You are going to measure a core strength in a plank. Who practice plank well perform better.
Yeah,
It doesn't mean they are very strong. You are going to assess the core strength in certain different way. Who practice that movement, they will perform better. Again, movement exposure. Motor learning and movement exposure comes into a picture. That is when we are measuring a shortest time to run 100 meter by running, not by jumping. So running improves. So we are practicing running.
And also why we are concentrating only the one muscle is the reason, because we are overdiagnosed. Because sometimes we don't know about the non-specific overdiagnostic. Scapular dyskinesia, we know, scapular dyskinesia is there. But when you need to concentrate, when the grade 1, grade 2, if I find out the mild mistake on the scapular movement, that is a scapular dyskinesia. If I found out that, I am a good therapist, I am a skillful therapist, we think like that. But that is not true, actually. So the scapular dyskinesia means when we need to address any neurological symptoms, like any long thoracic nerve or any spinal accessory nerve. Because of that, the surrounding muscles, the wastage is there, spiral deformity. So most of the things are there. So that time only you need to assess that is a scapular dyskinesia. So other time you no need to diagnose.
Great.
If you are diagnosing also, that is not a problem. But in I think 2026, Solana et al. Meta-analysis, they perform one thing. The sports who they play in every sports, okay, who find out, okay, this is the person who having, they think like that, the scapular dyskinesia, meaning the scapular muscles is not working. So they are just concentrating on the only scapular exercises, okay, and then the performance is not improved for them. Okay, here what I'm trying to say, the over-diagnostic, at the same time, because of the over-diagnosis only, we are concentrating on the only one particular muscles.
That's great point to add. So don't try to overdiagnose.
No need to point out the single muscle.
Single muscle theory. Maybe I think we can add this is diagnosis matters. How to diagnose a condition. And pain. Yeah, please.
Sorry, I interrupted.
What previously I mentioned, there is research says if you're having weak core, it doesn't mean it leads to back pain. Because for daily life functional activities, only 2% of rectus abdominis activity is required for walking. and I think 5% of external oblique muscle activation required for walking. So at just 2%, everybody will have that definitely. So weak core is not going to the reason for getting pain during functional activities. Very small amount only getting activated. And one more research I have to add, this it published in 2026. It is about Pilates. During Pilates, it is a randomized control study. They divided 152 or 54 population into two groups. One group performed Pilates with a core bracing. Another group performed Pilates without core bracing in a relaxed manner. Study found that the person who did Pilates in a relaxed manner, they improved a lot. Their pain intensity got reduced than the person used with a core brace technique. So core bracing itself is not going to helpful for reducing
Fear
pain.
mongering.
Yes, again.
So people will think normal day-to-day life activity, when they got pain suddenly second, third episode, I didn't brace my core, that's why I got pain.
Yes.
That is when so much into biomechanics for non-specific population, so much into single muscle theory, so much into postural correction into this kind of population doesn't help much. So uncertainty again very common. So what I would say, we'll come up with another podcast to discuss in detail about pain and how to diagnose and what is the diagnostic term we can use, how to educate the patient and everything. Depth of pain signs and everything we'll cover in another podcast. And I feel one more thing could be added very value in this podcast. I don't know, already time is exceeded. Maybe we have to do another podcast regarding load capacity model. How injuries are occurring. How injuries are occurring and the load capacity model. So you have any opinion about this podcast, these two topic podcasts you discussed, and which one you need immediately? Load capacity model and why a person suffering with pain or injury, or second podcast title is pain, signs of pain, rethinking a signs of pain, how to diagnose a people and everything, how to explain and what is patient education, how to educate the patient, lot of examples. You need that podcast. Which podcast you need next, please let us know in the comment section. So we'll come up with that podcast upcoming days. And this podcast uploading now, then next shoulder podcast part 2 will get uploaded after this. Maybe in next month when we come and take a next podcast shoot, we'll cut that video and we'll do that. Yeah, that's all thing guys. So hopefully enjoy this video. Maybe we talk a lot, doesn't mean everything is wrong, doesn't mean everything is correct. Apply context and take a decision wisely. For an example, we were overcome the situation to which is right, which is wrong. So now we are feeling we are doing some better thing. இதை மட்டும் கட் பண்ணிக்கலாம். So we would ask you to practice better and think wisely, to use and to understand the critiqueness behind posture, the critique behind over complicating the biomechanics, the critiqueness behind overusing that single muscle theory and activation doesn't going to help at all. So when you are giving quadriceps strengthening exercise after post-op or osteoarthritis cases, you can't activate alone vastus medialis oblique, and vastus medialis oblique strength alone doesn't going to predict the knee pain. Okay, so understand the context behind it, variability behind it, and think wisely, improve your critical thinking ability. Hope you learned something new and share your feedback. Don't forget to subscribe. Happy learning.